And joining us now is Dr. Farhan Bhatti, a family physician in Michigan and the CEO of Carefree Medical, a nonprofit that provides Medicare for low-income, underinsured, and uninsured people. Thank you so much and welcome back to BNC, Doc.
Good morning. Nice to be with you.
So there's been a spike in hospitalizations, as we all know, and experts predict that the numbers will soar as people gather for Labor Day. So what are you expecting to see over the next few weeks and months even?
Well, I too expect to see a rise in cases beginning within the next 2 or 3 weeks as we see more people returning home from travel. Many unvaccinated people, unfortunately, decided to travel this weekend. Airports were reasonably busy, and people are gathering in close proximity without masking. And this is problematic. And with the Delta variant being so much more contagious than previous strains of COVID, unfortunately, I do expect to see cases to rise.
And just amplifying that situation over the weekend, hundreds of thousands gathered for music concerts out of Las Vegas and Atlanta, college football games around the country. So what are your thoughts on gatherings of this magnitude?
So anytime you have a large gathering of people in very close proximity, you run the risk of transmitting the virus. This virus is airborne. And so if you're within the radius of someone else who's infected, and then they breathe on you, they cough on you, they sneeze on you, and you breathe in those particles, you can get it. And if you're, in shouting range, or if you're at a sporting event immediately next to a person who's infected, the fact that you're simply outdoors doesn't necessarily protect you. If you are, shouting because you're happy or mad at the officials, for example, and somebody shouts in your direction and their spit kind of lands in your breathing radius and you breathe it in, you can still get it even if you're outside. So at the very least, people, when they attend these kinds of events, they should be wearing a mask to try to reduce the risk of spread.
That's a good point, because I even think about a lot of these venues, they may not have a roof, but they're still kind of indoors, but just without a roof. I'm like, I don't know if that classifies as outdoors. But let's move on and talk about how you treat low-income and uninsured patients. And you've seen the new spikes in cases firsthand. Now, I know many of your patients may be declining the vaccine. So, why do you think that is? And what do you tell those people who are still on the fence about getting the vaccine?
So there's a lot of reasons why many patients, including my own, are refusing the vaccine. Some of it is mistrust of government. Some of it is years of systemic racism. Some of it is just pure unadulterated politics. Some of my patients are very conservative, and they think that this whole thing is a hoax. Other of my patients are well-intentioned, well-meaning people who are minorities, African Americans, Hispanics, who think that, wait a minute, the government has done things before that wasn't necessarily in our best interest. And so I have a lot of empathy for all of my patients, even the ones who are conservative, because they're just talking back to me, saying the things that they hear on television. So I don't necessarily blame them. But what I do is I talk about the science. I talk about how the new strains of COVID really don't follow the same playbook. The playbook is entirely different. This used to be a disease. The initial strains of the virus used to be a disease primarily of the elderly, people with pre-existing health conditions, diabetes, obesity, COPD, asthma. And now the new variants follow a completely different playbook, where children are getting it, where children can even transmit it to adults, and adults can transmit it to children, and younger adults are getting it and dying. And the unfortunate thing is we can't predict who the people are that are going to get sick with COVID and get better, and who the people are that are going to get sick and die. There's no reliable way to predict that anymore.
And that is one of the aspects that is so terrifying about this virus is you don't know, and the impact that we're now seeing, lasting impact, lifelong in some cases, for our youth. But for those of us who have been fully vaccinated, we're hearing a lot now about this booster shot. So is there such a thing as getting that booster shot too early? And what is the recommended timeline between the second and the third shot?
So there's really no such thing as getting it too early. Right now, the science is always sort of evolving, and I understand the frustration in the public because they say that doctors like me and scientists are always changing what we say, and the thing about science is there's no egos involved. So what you do is you update your recommendations based on the latest data, and the latest data shows that immunity, from 2 shots may not be lifelong or may not be particularly long lasting. And so we think that 8 months after your second dose, you should get a third dose. And that will create more antibodies in your to fight off particularly these new strains like the Delta variant that are out there. And then, will 3 doses of the vaccine ultimately be enough? We hope so, but we can't say for certain. And the only way to know that is to just track people over time and see what happens to the course of illnesses, hospitalizations, and deaths as we move through into the future.
And Doctor, we're almost out of time, but have there been any updates about Moderna or Johnson & Johnson having their booster approved?
Moderna, I can say with certainty that within the next couple of weeks, they're going to have their booster approved. And I know that the federal government's working very hard to update recommendations for Johnson & Johnson. We haven't forgotten about the folks who got J&J. Those folks are going to be getting a booster too. I just personally don't know the timeline for that one yet.
All right, Dr. Bhatti, thank you so much for starting your day with us.